Child obesity in Mississippi. Team B is Brandy, Donna, Angela, and Samantha. March 9th, 2015. Community and Public Health, Instructor Brandy Merriweather. Child obesity in Mississippi is a prevalent problem which needs to be addressed at once because of its serious consequences on health, academics, and the economy. It is encouraging, however, to note that the state has launched policy objectives to guide schools and families in the aim to curb obesity among school-aged children. Why is child obesity a serious concern in Mississippi? According to the Mississippi State Department of Health, obesity among children is a leading health concern. As of 2009, Mississippi is officially the leading state in child obesity, a full 6.9% higher than the second place. The Mississippi State Department of Health also notes that 40% of children living in the state are overweight or obese. In a survey by Mississippi Kids Count, the percentage of obese school-aged children ages 4 to 18 is as follows. You can see in the map we have District 1 through 9, District 3 being the highest percentage of obesity, and District 9 being the lowest. Interestingly, even the lowest rate is almost near the national rate of 17.3 for child obesity. According to research funded by the Trust for America's Health and Robert Wood Johnson Foundation, 13.9% of children ages 2 to 4 are obese. On the other hand, the report by Mississippi Kids Count shows that 33% of children between age brackets of 4 to 10 are obese, while 20% of children ages 11 to 13 are suffering from obesity. The impact of obesity. The obesity problem has severe consequences on children and the economy. According to the report compiled by the Power Initiative, a program by the Mississippi Department of Education's Office in Healthy Schools, obese children tend to miss more days in schools and have lower academic performance. The report also shows that 80% have the chance of being overweight and obese when they become adults. Rather, they are at risk of incurring chronic diseases that lead to disability or premature death, such as coronary heart disease, type 2 diabetes, heart disease, hypertension, osteoarthritis, sleep apnea, gallbladder disease, respiratory problems, stroke, endometrial cancer, breast cancer, colon cancer, prostate cancer, depression, and many more conditions. On a national level, obesity among children costs Medicaid more than $3 billion every year. There are 10 existing policies launched by the state of Mississippi. Mississippi still does lag behind the rest of the nation, but continued commitment to full implementation of coordinated school health through existing state policy can help the current generations of children to grow to be fit and healthy adults. It means that obesity can be solved. First, it has endeavored to improve built environments to promote physical activity in communities. This policy is aimed to encourage physical fitness in Mississippi. Secondly, the state aims to replace fryers with combi ovens in school kitchens. This is to promote better diet and food intake in school. A third objective is to increase the number of school nurses in the schools so that kids' health can be monitored regularly, and, in line with this, the fourth policy is to support comprehensive fitness testing in schools. The fifth policy is to improve state standards for daycare centers and youth programs to promote healthy lifestyles so that schools will make it a part of the child's daily routine. The sixth policy is also related to better food choices. Encourage recipients of public benefit programs to purchase healthy foods. In order to push this agenda, the seventh policy is to control media advertisement in order to restrict advertising of unhealthy foods to children. At the same time, this policy will require public services announcements that offer healthy messages. We all know how susceptible children are to the advertising that is geared toward them. If we make it toward healthy options and activities, maybe they would desire that rather than the junk that they see. The eighth policy objective is to require schools to provide the BMI, which is Body Mass Index, reports to parents. This is so that parents will be well aware of their children's health conditions and properly address indicators of obesity. Ninth, the state will promote improved access to supermarkets and its products so that accessibility to better food options are available to all. Finally, the 10th policy objective is to require labeling of menus and prepared foods. Having mentioned the policy goals that the state of Mississippi will implement, it is evident that diminishing obesity can be accomplished if the state, the schools, medical institution, and the parents, or whoever is in charge of the children at home, cooperate. But performing this will be efficient only if there is accurate monitoring of health and diagnosis investigation of the issues. Based on the above policy goals, the state can monitor and diagnose health of children by increasing the number of school nurses, which is policy 3, and requiring schools to provide BMI reports to parents, which is policy 8. How about children who are not in school? The state must require all parents or guardians to submit regular BMI reports of their children to the nearest health center. The health center will be the focal point of public health monitoring so that the state will know which districts have the highest incidence of child obesity, investigate possible reasons, and address the causes before it is too late. Basically, at each child's checkup or at the school more frequently than it is now, these numbers would need to be reported to the state in order to monitor the child's health as a whole. Individual states retain much of the power to influence policies and regulations in the United States. Through legislative and regulatory actions, state governments are able to wield substantial power over specific actions that affect public health. Between 2003 and 2005, over 230 pieces of legislation addressing school nutrition standards and vending machines and over 190 addressing physical activity were introduced at the state level. Nationwide programs such as Let's Move and others bringing awareness to the childhood obesity are a catalyst to provoke everyone to get involved in the health of our kids. Taking these steps now will lead to healthier lifestyles and reduce the risk of children being predisposed to chronic illness that are associated with weight when they get older. As you can see here, there are some pictures of foods from other countries. Having access to healthy foods and being able to eat balanced meals will help alleviate some of the implications of obesity on children and the economy. Health and balanced meals not only fuel our bodies, but also help fuel our brains. With that in mind, take a look at the school cafeteria food from around the globe and ask yourself, how does the United States measure up? So far, it's not looking good for the home team. But that can be changed with the correct policies to make sure nutrient-dense foods are available to all children, regardless of race, sex, age, or family economic status. Also, developing policies that hold those that are in direct contact with the child accountable for their health. With rates of obesity and overweight reaching 50% in southern rural communities, intervening early in development may offer the best outcome because of the difficulties with changing lifestyle behaviors later in adulthood. A population-based approach is recommended over a target approach to cultivate a culture of healthy lifestyle behaviors when children are developing their health care habits. The International Obesity Task Force recommends instead that we focus on preventing unhealthy weight gain before it develops. Theorists and clinicians recommend using the social learning theory to achieve this goal because it addresses the dynamic interaction between the individual, their behavior, the environment, rather than focusing on just the individual and his or her eating behavior. Intervening early in development should yield the best results because lifestyle habits are established in early childhood. Utilizing a population-based approach appears to be the most promising because of its economical, reaches more people, and individualized treatment programs have proven ineffective longitudinally. When in the development phase of creating policies to address childhood obesity, it is important to consider the everyday environment that children are in and use that environment as a gateway to create partnerships with the potential stakeholders, those that have the day-to-day interaction with the children. Schools are ideal environments in which to make changes that will help children form lifelong healthful habits. Getting physicians to engage parents in their child's health is pivotal to the success in the fight against childhood obesity. Physicians' public roles have been defined as an advocacy for and participation in improving the aspects of community that affect the health and individuals and they have a primary ethical and professional responsibility for the health and community members they serve. Also, getting the parents involved and possibly enacting consequences on the parent that are not making an effort to support a healthy lifestyle for their child. An example of a policy that is already in place would be school absences and tardiness. Some school districts hold the parents liable for all missed days, and if the student gets past a certain point, the parent can be arrested. Regarding childhood obesity and a healthy lifestyle, the consequences may not have to be as severe, but a policy put in place along those lines to hold the parents responsible for the food that the child eats and the physical activity that the child is involved in. There are leaders and or organizations within the state of Mississippi that can assist with the policy development. 3 of them are elected officials, public health officials, local health department, and staff. This group of people was selected because they can provide the manpower to do the research and implementation for policy development. The health department can then work with more local organizations and community members to share the policies and provide resources to local organizations to put them into place. From here, community members and local organizations can engage parents, physicians, schools to help educate and encourage the children on a level that they can comprehend. Making healthy lifestyle changes a fun activity that gains and keeps the attention of children is the ultimate goal. The lifestyle changes, if presented properly, will have a lasting effect on the youth, promoting healthy living into adulthood. Being able to effectively inform, educate, and empower the state of Mississippi when it comes to addressing the issues of childhood obesity will start from a government level. This will start with mobilizing community partners. State and local officials have the resources to be able to gather teams, committees to address issues in the community. Starting with a diverse panel to do the research and creating a partnership with the stakeholders will lead to creating lasting partnerships in the community. Once these partnerships have been created, then they will be able to properly inform, educate, and empower the community. The information being given to the public needs to be accurate and not cause a panic among people. It's not wise to use scare tactics, but presenting the facts to educate the public on childhood obesity, what it does to children's bodies and minds, how it affects their future, and ultimately the future of our nation will empower the people to make better health choices. Additionally, once the research surrounding childhood obesity has been compiled, state and local officials can then begin to develop and implement policies that will promote healthier lifestyles in the early years of a child's development. We need to own it. Thank you, and that's the end.